within the Division of Public Health. And we have a program here we've been running for the last 8 years under a CDC grant that helps us really understand what's going on with climate, weather, and health in New Hampshire. And we're going to include health equity as a component of that. That's a lot to cover. And I'd like to ask for a couple more minutes beyond my 10 to do that, but I'll move through as quickly as possible so we can do that. Let's see if these are going to move. All right, so some useful terms. The greenhouse effect, most people understand that it is the buildup of gases in the environment, which is warming our world. One of the challenges they build up over the last 100 years, and they're going to last for decades further, if not forwards. That puts us in an interesting position in terms of adapting. Weather versus climate. Weather's a one-time event. It's what's happening in the atmosphere today, this month, this year, right? If it starts to happen over and over again, it becomes our climate, right? Those patterns. And we're seeing big changes in the Northeast, which we'll talk about. Adaptation and mitigation actions. Those are the two ways we really address climate change. I really do adaptation, but mitigation is important. Mitigation is reducing those greenhouse gases. Adaptation is, what are we going to do in the short term and medium term before we can reduce greenhouse gases further? Because we're having real impacts on our environment and our health, and we've got to address that. Social vulnerability. We've built a social vulnerability index for the state as part of our DHHS data portal, and that provides a lot of information on people's status, how vulnerable they are, maybe how resilient they are to a lot of the impacts that are coming our way. And fortunately, they've been able to include race and ethnicity in there recently. Climate justice. Now, I'm not an expert in this. I'm learning a lot as we go, but really it's a frame of climate change as an ethical and political issue rather than purely environmental and physical in nature. And if you've heard any talks on climate change, they're often very data heavy and complex. This is a way to change it and take it and say, well, what about the people who are truly being impacted? Is this just, is this right? And how do we influence that? And finally, two phrases I'd like to use a lot in my terminology are I don't know, and I was wrong, right? It's part of being humble, but there's so much to learn here. I don't mind saying that day by day. And I just admitted it for mitigation. There's a lot more people who know a lot more than I. So let's talk about some of the hopeful aspects, right? Climate change, unfortunately, comes across the mass media and across our social media platforms as a very threatening and dangerous issue right now. It's hard to have hope, but I like this quote by, is it Danny Martinez, the Confederate Tribes of Warm Springs. That's in Central Oregon, and it's the Wasco and Paiute people. But I like that he emphasizes that even though we don't know exactly how to solve the climate crisis, we have a role to play in our own communities to connect each other and connect to the earth. Very important to see the positive and feel the positive as we get out there in our own communities. So what's the problem? As we said, some people look at it as a very pollution-oriented emissions problem. Other people see it as a technological one. Others see it as a social and political. We've talked about with kind of that with climate justice. And others say it's a communication issue. I'm a health educator by training, so I tend to focus and fall towards the communication side. And there's a lot of good information and there's a lot of disinformation out there, right? So we have to know how to recognize that. What do you need to know today? 4 things. The Northeast climate is getting warmer and wetter with more severe weather, right? And sea level rise. Is that better or worse than other parts of the country? California is getting warmer and drier, right? Maybe with severe weather. We'll see if wildfires fit into that category. I have to ask meteorologists because I don't know. And sea level rise really is influencing us. Not only is it rising in all parts of the world, but we have the East Coast is actually dipping and subsiding as part of its tectonic plate. So we may see impacts, greater impacts here. I'm going to divert this here in New Hampshire and along the East Coast. All right. Weather and climate conditions influence 3 main outcomes in New Hampshire. Short-term weather conditions, and I say weather, not climate, because we work through weather to get to climate, right? Include heat stress. We're definitely seeing that in New Hampshire. All-cause injuries and tick-borne disease. Those are the 3 that we really can say are driven by weather and weather conditions and to some degree a changing climate. Longer-term climate is a little more challenging, right? More complicated. Not known to drive rates of asthma or cancer in New Hampshire. That's important to know as public health professionals. As public health professionals, we need to prove an exposure pathway. We actually have to choose a hazard and walk through that, showing that we actually have exposed people to that, or they've been exposed, and that they've resulted in a specific health impact. Not the other way, right? We don't choose a health impact and then go back in the other direction. Most of the epidemiologists on the call will understand that. But we have a lot of big data gaps, right? We don't know a lot about pollen and allergies in the state, and we don't know especially a lot about stress and mental health. So those impacts may be occurring out there, just harder to see. All right. Next, let's talk about beliefs. Another problem is our beliefs are polarized, right? This is data from Yale that kind of looks at, was kind of presented as something called the Six Americas Report, which kind of segments the audience or segments the people who have opinions on climate change. And you can see on the left side of the image, you can see the high percentage of people have belief, have major concerns, are motivated to act. On the right side, you can see the lowest percent of belief in human-caused climate change, less concern and less motivated to act. Now, you could debate whether they actually are less motivated to act because we see a lot of action on that side. In the middle, you can see people who are cautious and disengaged. A question for yourself you should think about here: where are you and where you want to be? Right? You can put a note in the chat, or you can talk later on. I would like people to move to the middle. And it is happening. People are moving kind of out of that more alarm stage and out of that dismissive and doubtful stage, more to the center. The challenges of being alarmed is often you don't make great decisions when you're alarmed. It's good that people are really aware, and we've done a great job, I think, in some ways, of demonstrating what the impacts are of climate change. But as people get into that alarm stage, they also, maybe become more fearful and lose hope. And we need hope as part of this for ourselves and for our kids. So what's the solution, if we can say all this? We need to learn about the hazards that are out there and the health impacts. We're doing that today, right? That's part of what this is about, so we can spread accurate information. We need to adapt to the short-term effects via building individual resilience to specific health effects. And we just mentioned those three. We need to adapt in the short-term effects by identifying at-risk groups, acting on health disparities, and promoting systems level change, right? It's not just about ourselves, it's about trying to change our society. And we need to mitigate the long-term effects via individual actions, market forces, and good public policy for reducing greenhouse gases, right? Those are things that are a little more challenging, right? We'll get into the political realm, but you can do things individually to reduce that too. Oops, sorry, I'm a little bit back on the clicks here. So I'm going to talk a little bit about what we're doing in New Hampshire to adapt, right? This is just our program. There's lots of people working, doing good action. I think these are important because we really do interventions where we measure pre and post how we've been able to change individual knowledge, skills, and their kind of confidence or ability to act. So you can see here in the blue is our program center in the middle. And on the right is the Seacoast area ticks and youth, where we're intervening to teach tick-safe practices to adults and caregivers who then teach them to children and try to protect them at outdoor camps and childcare centers. And on the left at the bottom, you can see the Monadnock area, very floody area. We've seen a lot of floods there in the last month or two, as well as over the years. We're working there to build resilience by also doing individual training to teach home emergency preparedness, how to access alerts and weather systems, and how to stay involved. We've done other projects in heat stress in urban areas, in Nashua, in the Upper Valley, heat stress among elders, and also more tick-borne work in the Lakes region area. So we're trying to get out and actually change that, but there's limited amount you can do at the individual level. So we're looking towards other ways to adapt also. We've also done a lot of assessments with our academic partners about looking at the air, water, weather in relation to human resilience. We do seasonal messaging here, spring, summer, fall, winter, where we try to talk about what are those health effects that happen in each season. If we can connect people to weather, we can connect them better to the health effects and how to resolve those. And we have stakeholder meetings, just like this one. Twice a year, we get together with 30 or 40 of our main supporters, and we talk about how are we making an impact? What can we do in the future? How are we being effective? All right, what about health equity? This is not my area of expertise, but I'm learning a lot. That's a great thing about doing these presentations. You may have heard that an EPA report came out last week on climate vulnerability, where they tried to look at who's impacted now across the country by race and ethnicity. and also who's expected to be impacted in the future. One of the findings was that Black and African Americans are more likely to live in areas with current and future impacts on childhood asthma and heat-related deaths. Hispanics and Latinos are more likely to live in areas with the biggest reduction in labor hours. You imagine people working in labor outdoors in hot conditions. It's really going to stress their bodies, but also if they can't work, it's going to reduce their income. American Indians and Alaskan Natives more likely to live in areas at risk of flooding. They tend to live in river valleys, certainly, and certainly along the seacoast. So they're more vulnerable to that. You've probably seen some of that reporting in Alaska of communities that are living on the edge and beginning to lose their communities because they're washing away in erosion. I mentioned before about the social vulnerability index. This is an old graphic for it. There are updates, and actually, if you see along the side on the vulnerability measures, it does include race and ethnicity now, but you can go to our DPHS data portal at that address there, and we'll share these slides with you. You can look at this social vulnerability index and try and find out in your community, actually neighborhood by neighborhood, down to the census block, certainly in the larger cities. How people are impacted when they're living below the poverty level, when they have, no high school diploma, when they're older or younger, right? All those things provide vulnerabilities because you're less easily able to adapt. Okay, climate inequity. There are some positive trends. Once we begin adding health equity into our discussions, we begin to kind of see a chance for multi-solving of problems. And you've studied health equity at all. We try to look at it with a kind of a triple aim, right? We want to do research, health equity research, and we can do those through some of the data tools we talked about today. We need to provide better and more services and improve capacity, and we can do that through improved access and support. Some of the interventions I talked about are that, but really talking about the things people need, not just training, right? Day-to-day living and eating, and being able to have income and a job. And then policy change, and I want to say via voluntary and required actions, because we know how challenging change can be, or policymaking can be at the legislative level. So we're looking for other ways we can do it at the agency, corporate, and community level too. So I mentioned before, we do a lot around individual training. We're trying to, this kind of program is changing its focus from building individual resilience to community resilience via system change and improved environments. So we don't want to just make individuals stronger, smarter, more resilient. We want to get to working between agencies at the community level. So when we move away from a funded project or something else, those groups are still collaborating, support, and keep people strong. I think one of the best examples of that kind of community resilience was the Affordable Care Act. That has made a significant change for people. It changed the way they live, especially for working people who are lower income. It was a big effort, and it provided people with that kind of floor they could stand on to maintain resilience. So it's not just what we do with each other, it's some large federal and other changes that make us more resilient. A couple of projects around this where we're going to try and build more of that community resilience is there's projects to address home and school environments to reduce COVID-19 and higher transmission areas. So that means going into homes and assessing transmission risk for COVID as well as other droplet-borne diseases, going to school environments and making sure that they're clean enough and they have the right ventilation to be able to protect the health of their occupants. And then we're going to be working on a project to address rental homes, allergens, asthma, and weatherization. So these are examples of kind of where we're either leading and following, trying to help people address not just the health effects, but also the health equity issues. We want to focus and target these projects in areas that have higher COVID risks, higher COVID transmission, or lower vaccination rates. So what to do next? Based on kind of what we just covered, we know the main climate effects in the Northeast, and especially New Hampshire, are heat, storms, and pests, right? Getting down to the kind of ticks, so very weather influenced. Yet many data gaps exist and significant challenges to solve are ahead. There's good reasons to act and have hope. Catherine Hayhoe, who's one of the great climate scientists who works on the National Climate Assessment and IPCC reports, and also evangelical Christian, talks about how she works with her community to drive hope and kind of connect on a values level. And she said something really interesting. She said, you don't find hope and then act. What you need to do is you need to act on these things, and that builds hope. So I want to emphasize that as, we can have hope and we do it through taking action. You can build individual resilience. We talked about that to climate change by learning how to adapt to heat storms and ticks. So you can go out yourself now, learn about how you better adapt to heat. You learn how you adapt to storms and have emergency preparedness kit at home. Know how to carry the right repellents and avoid tick habitat. Those are all things you can do today. And that provides hope, I think, that you can change and reduce your risk. You can build community resilience to climate change via focus on social vulnerability, engaging with peers, working with those in need, and maybe changing policy, right, if it's possible. But that's one of the bigger challenges. So I think that's about it for my presentation. Tried to make it relatively short, but it's hard to put everything into 10 or 15 minutes. So we want to have a discussion, and I think we may have a breakout group on this topic later on today. We'll see. So I threw a couple of sample questions out here that people can look at, think about, and then ask your own. I'm not sure if they're going to go into the chat or people are going to open up. So let me know, Trini, or whoever's in charge of that.
Yeah, well, does someone want to pipe up? I don't see any questions in the chat yet.
Holly has her hand up.
Super, thank you.
I have a very specific question, and I hope I've been having trouble with my audio on Zoom calls late. But as far as mitigation for air quality, is there any plans to do an assessment of the current air quality in the State House and what the current plans for mitigation measures, what an assessment on whether it will actually help reduce any virus load in the air. Now that we're coming up to the legislative session, there's a lot of concerns among advocates, stakeholders, and lobbyists that the air quality in the State House is going to be very poor and a breeding ground for COVID-19, which will dissuade a lot of which will dissuade a lot of folks who may have some medical issues from attending hearings, and will create really an inequity at the State House.
All right. I will try to answer that. Can you mute everybody and then I'll kind of unmute myself?
To inquire about your current order, please press 2. To inquire about an order that you have received, please press 3.
Dale, can you mute everyone, please?
Press 4. To repeat this, to place an order, or if you have questions about products or the website, please press 1. If you have...
All right. I think we got through that. All right. So, you were breaking up there, Holly.
Thank you for calling printing. This is Janine. Would you have
Hi, my name is Bruno. I have a question about your product.
Bruno, we're still trying to clear up our line and answer the first question.
Please help me.
Are you able to hold your question?
Sure.
All right, now I think the lines are open again, and we have one question from Holly and another question from Bruno. So let's see if we can try to address those. I think one of the questions, Holly, and I'm sorry you were breaking up a little bit, was what do we know about our air quality, outdoor air quality in New Hampshire? Then you had another question about our indoor air quality. So outdoor air quality, there's some good news there. We have been reducing our amounts of particulate matter and ozone over the last 20 years in New Hampshire, made significant advances, and that's another reason for hope, right? The Clean Air Act is working. We have challenges ahead and we need to have more to do, but overall, we generally have cleaner air than many parts of the country. That's the outdoor air quality. The indoor air quality is a little more challenging, right? I ran the indoor air quality program for the state for a number of years, And I think your specific question was, as they open up the State House and people are in there without masks, without vaccinations, is that going to increase the amount of virus in the air? And is it going to lead to a higher risk? I think because we know this is primarily a droplet-borne illness, that wearing a mask yourself, a high-quality mask, could make a big difference and obviously protect you. But we know the Delta virus, it's much more transmissible, and regular masks may not be as effective. So I think increasing ventilation and opening windows would be an important part of reducing risk there. And I don't know if anybody's planning to study it, but I would say that, you know, it would be challenging to have a low risk environment while you're in a place. Any indoor gathering, as the CDC says, is a higher risk environment. Anybody else like to expand on that?
I don't know about expanding on that, but I do want to point out that Rick Menard and Victoria Adewumi had their hands up. So then Bruno can be after they ask their questions. And I don't see if anyone else has their hands raised.
All right, go ahead.
Hi, Matthew. Thanks for your time here this morning. I used to be the Deputy Director of the State Office of Energy and Planning and was involved in a couple of policy initiatives at the time. I just wonder if they're actually moving. To deal with the heat stress problem, we were trying to make sure that the state weatherization program included cooling. It had traditionally just been about keeping people warm in the winter, but we need to keep them cool in the summer. Is that happening? And is there enough money to deal with more than the 24 homes per year? Question two, building codes. The state had been 10 years, maybe 20 years behind the rest of the progressive nation in developing and imposing building codes that would require energy efficient and good air quality in buildings. That's really important in dealing with the regressive impact of climate change on low-income households. Any progress there?
All right, so my other hat I wear is I manage the health officer program, you know, so those are the people that enforce rental housing standards across the state. Right now, we have a minimum temperature standard of 65 degrees, I believe. We do not have a maximum. So they're not able to go into rental housings and say, it's too hot here. Your issue around the building code, where we're trying to use that to have more efficient cooling of our buildings and better weatherization, right? Those are key things, keep it cool rather than let it get hot and cool it down is the idea. I mentioned that project that we're hoping to work on looking at rental housing and asthma. And one approach there would be going to have health officers go in, assess, find out what the major risks are to health and asthma and triggers, and then be able to recommend and work with weatherization professionals to improve their resilience to those high heat days. We are tracking heat stress in the state. We do it through our syndromic. It's quite variable. The epidemiologists on the call know how challenging it is to take a specific measure like heat stress and associate it with a population and show the outcomes that come there. I would say that the people at most risk from heat stress in the state are outdoor workers and the elderly, and we see that in the data. And we see on days with heat stress over 85 degrees, the amount of people going to the ER for dehydration, kidney problems, I believe some respiratory problems, as well as heat stress, really goes up by 6, 8, 10%, depending on the population. I hope that answered part of your question, but you had two.
Not really, Matt.
All right.
My question really is anybody trying, the problems are pretty well understood. And I appreciate that more data is helpful. But the building code is behind. And is the state moving to change and adopt, you know, the most recent energy efficiency and health-based building codes?
I don't know.
That's step one. I mean, that's a policy that the state could be taking, and has been resistant. But in dealing with this, you know, we have just heard that this climate change is the #1 global health threat. Let's deal with it here in New Hampshire.
Mm-hmm. Yeah, I think we are, as I mentioned, on the ground trying to address it in different communities. But does anybody else, Bruce or others who are working on in the policy realm, have a response?
Rick's right. That's the first one. This is Bruce. I happen to now be the chair of the Easy Board, and updating the building codes was one of the subjects that we talked about a good amount last year. There was a legislative attempt to do that, and it failed in the House. So people are trying, people will continue to try, and it's hard work, and we need to expand the voices that are saying these things. So that's kind of why I'm engaging with the healthcare sector and the public health sector now, is to find ways to expand the people interested and being willing to talk about being interested in things like that.
Thank you. Victoria is up next.
Can folks hear me? Wonderful. And please forgive any background noise. I just want to say thank you first and foremost for a really incredible presentation. It was so enjoyable. And I have a question really related to framing. And so I'm thinking a lot. I have the real privilege of getting to do a little bit of work in the Baltimore area with activists of color. And I'm borrowing heavily from Glenn Ross, this idea that when we talk about environmental issues, it often centers images and pictures that don't always relate to communities of color. So this idea of the snow-capped mountains, of saving the animals, and that this is not kayaking, that this is not necessarily always relate to communities when they think about environmentalism or when they think about climate change broadly. But things like asthma, having environments that are rat infested, or what we're seeing, and I'm in the Manchester area, folks who are living in apartments full of bed bugs and other really intense environmental issues, those do matter. So I'm curious if you have any thoughts or reflections about how we frame this issue and how we can center the lived experiences of individuals who may not always relate to environmentalism when we talk about it in broader terms. So any thoughts or comments on that?
Framing, my framing is really to talk to people about weather first and climate second in many ways. It's a primary, driver of human health impacts. We can show that. And when you talk about framing weather and to communities of color, people of color living communities, I think talking about the stressors that occur with heat stress, the ability to improve their living environments, housing, making their streets safe and more livable, walkable, bringing in green infrastructure to make it more comfortable. Those things that seem more relatable to me. So we've talked with the city of Manchester about what would be a way to kind of green the city more, and to improve the quality of the environment, the neighborhoods, as well as to make it cooler. Those are kind of out there. That's some of the framing that I've used in the past. And I mentioned that I work on the health officer program, so I have to take calls on bed bugs, infestations, uncomfortable living conditions every day, or every day now, because my staff member is actually out on maternity leave. But usually I've taken hundreds of those, and how you frame it and talk to people about their current conditions and how they make them more comfortable is something that I'm familiar with, but I haven't worked on it particularly with BIPOC or the communities that communities of color in New Hampshire. I think Bruce has kind of initiated some of that in Manchester, and he might have a perspective.
We're working on initiating a program there, so we'll have hopefully more to talk about that on sometime soon.
So I would like to talk to you more, Victoria, about how we reach out to those communities in New Hampshire. We've got great health departments in Manchester and Nashua, like the big cities where a lot of those communities are. And I find they handle most of it. I actually don't get a lot of calls from those communities because they do such a good job on environmental health, and they really want to take the lead. But there's opportunities. So let me know if you see a way we can take it into the community, frame it differently, work on the real concerns they have as we address climate change and environmental health issues.
Thank you. Clearly,
Absolutely. And I have.
Oh, go ahead, Victoria.
Oh, please. I was just going to say, I sit at that Manchester Health Department that you mentioned. So I am absolutely, and I've had the privilege of meeting with Bruce not too long ago. And so I'm excited to continue that conversation.
Great. I look forward to meeting you.
Yeah, and there's so much interest and energy here. That's why there's possibly going to be a group that's part of our conversation, right? Whether we have a new work group dedicated to these issues. So I think next after Victoria was Bruno.
Hi, I'm sorry. I was looking, yeah, I was looking, yeah, to unmute myself. Um, yeah, I mean, I don't have, like any questions, but, yeah, this is, like a very, like interesting conversation. Um, I am, working with the, like New Hampshire Brazilian Council, and we're definitely, trying to incorporate, like equity in our community, and and I have told like different people in different conversations that everything like is interrelated. The weather with immigration, and immigration, like with the weather. So so it's interesting. So thank you.
Hey, Bruno, let me ask you a quick question. In your community, I think you said the Brazilian community, do they, you talk with your friends or family about the impacts you're seeing, weather or climate wise? You see extreme heat changing it, or storms, or, ticks affecting your community?
Yeah, so I mean, more particularly, like in Brazil. So yeah, no, so pretty much, yeah, we definitely talk about it. Like as a matter of fact, like my ex-girlfriend who lives in Brazil, um, keeps talking about it because like one day is extremely like cold, like and the next day is extremely like hot. um like in New England, like we have those kind of different things, like in the morning, it's raining, right after, like it's sunny, and then like close to like the evening, it starts snowing. We see these, kind of, different things, like here in New England, like, but, the shift in the temperature, yeah, I mean, I at least I haven't, like experienced, like so much here. But, yeah, I mean, definitely, yeah,
No.
like,
Yeah, keep
definitely.
talking to your friends and keep recommending ways they can adapt to the changes they see coming. We mentioned some of them today. There's more information you can get online just to make sure they're protected. Sometimes I think we should be calling this climate disruption, not climate change, because it's so variable, right? We see so many swings in weather. It always isn't just about the slow changing of it. There's important and radical things that are happening out there. So I'll do a time check now to see if we're on track and if there's any other questions.
There is one more question. Well, now two more questions. I think when we have these interesting presentations, we like to go with the energy of the group. So Melina and then Bartolome.
Thanks, Trini. Thank you, Matthew, for your presentation. I have a couple of questions. First, whether you have a definition for climate change versus or climate justice versus environmental justice. So at the Endowment for Health where I work, we have been supporting the Conservation Law Foundation, Tom Irwin, and now in collaboration with Arnold Micolo, looking at issues of environmental justice in Manchester as a start to looking at environmental justice issues around the state. So I guess my first question was the definition of climate justice versus environmental justice. And then my second question about the organizations and people your office is collaborating with to address these issues.
All right, so not an expert, but I did kind of say climate justice is a term to frame climate change as an ethical and political issue. I would say environmental justice would be similar, but I haven't studied it. So if anybody else has better information, then I would say that climate justice would be a subset of environmental justice, right? If our whole environment around us has moral and ethical issues that come up and political issues, that we can frame those in certain ways for certain populations, for certain conversations we have to make them happen. But I don't have a specific definition. I just know when I go out into the communities, I frame my conversations as sometimes long-term weather change, right? If it's a more conservative group, and then human-caused climate change if it's a more progressive group that's open to that message. So in New Hampshire, I have to do it different ways and frame it in different terms. Now you had a second question. I'm sorry, I'm trying
My
to
second
remember it now.
question was regarding the organizations that you collaborate with, and more specifically asking about whether you collaborate with the Conservation Law Foundation and the work they are doing, which is funded through the foundation I work at, the endowment, on environmental justice in Manchester, because you spoke about Manchester.
Yeah, no, I haven't worked with the Conservation Law Foundation. I have worked with the Nature Conservancy, and we've got Bruce on the line right here. We've been talking about how do we draw healthcare workers and public health workers into this conversation around climate change. So we've worked on that, and there's a new group that started up called New Hampshire Healthcare Workers for Climate Action that's now meeting, primarily nurses, doctors, clinicians, psychologists who are trying to say, we see changes going on not just in the world, but in our patients, and we want to try and communicate that. So that's one of the groups I work with. As I mentioned, I have my own stakeholder group, or the climate program does, which has a wide variety of people there, some people who are on this call. And we know that the other groups within public health are working on environmental justice issues, not necessarily myself. I've been kind of part-time working on climate change for a couple of years for a couple of reasons, and now going back to full-time. So it takes that extra effort and time to get out and really build those relationships. So those are a few of the ones I have. I certainly collaborate with public health networks, with the city's city health officers and health offices, but I do not have, and I don't have a kind of direct connection right now to communities of color.
If you could please put your contact information in the chat when you have a moment, then I can make the introduction. Thank you.
I appreciate that. I have been trying to meet with Arnold. I knew I was working on climate justice in Manchester, but haven't been able to make it happen yet.
Hey, thank you, Melina. Bartolome?
Hi, good morning. Thank you, Matthew. I have two questions. Where can I find data or information related to the weather is affecting the Latino community here in Manchester? That's my first question. I don't know if you have that information in your presentation or in your webpage. So the second question is, how is the weather related to COVID-19? Is this a factor that could the people get vaccinated or not?
So your first question about getting data for New Hampshire, you'll see, I think I've got the slide reloaded if people can see it. Is it still being shared?
Yep, okay.
All right, good. So this is the New Hampshire data portal. So you can go to this website here. You can look at the social vulnerability index, which is specific to climate change and weather disasters and who's vulnerable to those. And you see the map here. You know, the darker areas, certainly in Manchester, Nashua, and across the state are the ones who have higher levels of vulnerability because they have more of these kind of census factors that are influencing their ability to respond and be resilient. And then there's something else called Community Health Outlooks by region. It's at that same website. And you can go in and access that and get even a closer view of what are the true health impacts and to some degree, the environmental hazards that are influencing those groups. Within that, you should be able to break down, I don't know actually if you can break down, yeah, I think you can break down Hispanic and Latino communities within, but I have to go back and look. And if you want to contact me at my email, I'm about to load it on here. There we go. I can help you access that or connect you to the people at the Department of Health who can do that.
Okay, thank you.
So that was the first question, and you had a question. What was your second question?
What is the relation between the weather and the COVID-19? How could this affect people get vaccinating? You know what I mean? I mean, it's too hot. I'm not getting vaccinated. I'm not getting out of my house today. Okay, or it's too cold. I'm not gonna get vaccinated because it's too cold. I don't want to get out. How is affecting this the Latino community here in Manchester?
Yeah. In terms of the weather affecting COVID, I've seen a couple of studies of that. Just like other droplet-borne diseases like influenza, as it gets colder, people go inside, they spend more time there, and there's more chance for that droplet transmission and micro droplet transmission now with the Delta virus. So that's one impact. I'm not sure how it affects the vaccination rates. It makes sense that extreme weather conditions keep people away from, you know, other indoor environments and going out to get a vaccine. I don't think that's the main driver. I think there's other emotional, behavioral, and things that are driving that. But I haven't looked into it, so I don't know a lot about it.
Okay, thank you.
Thank you so much, Matthew. I don't see any other hands up, but does someone want to pipe up if there's any final questions or comments?
Yep, this is Carol Tatske from Department of Health and Human Services. Hi, Matthew.
Hi, Carol.
I want to ask if you're familiar with the book released by the American Meteorological Society, written by William B. Gale, Climate Conundrums, What the Climate Debate Reveals About Us. It's a very...
Sorry, I'm missing, I think, some of your conversation. Did you finish it? Not hearing anything, I'll try to give a reasonable response, which is I rolled back the slides back to that one what looks the 6 Americas. So although I haven't read that book you're talking about from the meteorologists, we do have a conundrum, right? Our beliefs are polarized. Opinion surveys show that it's polarized, but it's moving in the right direction in the sense that people are more alarmed, concerned, and cautious. The number of people who are disengaged, doubtful, and dismissive is declining. I think there's challenges with that, right? Because I think I mentioned there's problems with being too alarmed. You can lose hope, and you can, basically, how do I say it? There's disinformation on both sides, right? People will claim that all health effects, any elevated health effect is due to climate or weather, and that's not true. We know through our work with epidemiology and biostatistics, there are very specific things that affect people in New Hampshire and people in general based on the weather and climate impacts. And we want to be clear, and I want this group to join me in that kind of radical center. Be concerned, be cautious, really engage, know what you want, know what you know, right? And try not to spread other information that isn't clear or based in science from the CDC, EPA, or other really respected groups. That's an important thing. I think if we join together in that kind of radical center, wanting to change the system, wanting to change health equity, we can really be much more effective. And I think we're more likely to draw people from both sides to join us in the middle and try to do better work. That's a place where I think there's more hope.
Thank you for that. And I did put the book title, author, and
there it
who it
is.
was released by for anyone that's interested. It's a very interesting read, and I highly encourage folks that have a passion for this to review it and share it with your friends. Thank you.
Yeah, I mean, I think the climate debate really reveals that we have very different values on both sides of the political spectrum. To learn the values of the other side or both sides is important for us. And I think it's important that we realize that we can have all the information we want on climate change scientifically, but until we get down to kind of understanding people's values and understanding how they emotionally react to information, it's hard to make your point. And we see this in our own families, in our own worlds, that if we can connect with people on an emotional level, we can usually get a lot further than trying to drive too much information and statistics at them. So talk to your friends, listen a lot, and try to win them over to we can join in the middle, and we can get a lot done individually, and we may be able to get a lot done on the policy side.
So thank you so much, Matt,